Hello, I'm Dr. John Bergman, and this is today's rant. Okay, what it actually is let's look at healthcare 100 years ago. Now, if you look at medical books 100 years ago, at the turn of the last century, they practiced bleeding. Okay, what this was is taking the bad blood out, okay, and getting rid of the evil spirits or whatever the heck it was. Okay, that was started by the Egyptians. We look at those times as ignorant and unscientific. 100 years from now, guess what they're going to look at? Our treatment of how a body degenerates, okay, has foolish and completely non-scientific approach. Your body has the ability to regenerate, to rebuild itself. What we do in our society today, and what's current medical practice that's accepted, is we make people comfortable while their body rots. Example, let me show you what a normal side, now this is looking at the side view of a neck. Normal side view of the neck, you have beautiful clean discs, great curve, phenomenal disc space, and that curve is called the arc of life. Now look at this one next to it, okay? We're talking no curve in the neck, and you can see it's been there for a long time. You're starting to see the joint come down. You're starting to see the disc space crushed. You're starting to see the bone deteriorate. Now what we call this is degenerative joint disease. You can also call it degenerative disc disease. You can also call it osteoarthritis. They're all the three names, okay, for the same thing. The problem is, how is this treated? We realize that the body has the ability to regenerate. Do we work with that? Common medical practices, no, we do not work with the body's ability to regenerate. What we do is we make people who are suffering from this condition, make them comfortable while their body rots. That's nuts! 100 years from now, they're going to look back at this as just, how could we possibly know? If we knew the body has the ability to regenerate, why do we make that person comfortable while their body deteriorates? That's nuts. Right now, this patient here has been hurting for over 10 years, and we treat him with what? A pain reliever. Oh my gosh, that's toxic to the kidneys, toxic to the liver, weakens the immune system. An anti-inflammatory, great, that wipes out part of the immune system. Muscle relaxant, central nervous system toxin, those are ridiculous. If you had a dentist treat you that way, you'd fire the dentist. You'd want him to fix your teeth. Let's fix the spine. I'm going to show you a couple of examples. Again, before and after. What you're looking at here, this is a straight view of the lumbar spine. You're seeing it bent, turned, and twisted. What do you think the force loading on that is? Do you think it's going to be equal or unequal? Unequal, absolutely. You're going to start to see the spine deteriorate. What do? We corrected it. Again, person sitting up, bent off to the side. You can see those joints are at an angle. You can imagine that nervous system is compressed. But we're just talking about degenerative joint disease, osteoarthritis. Is this person going to start to develop it? Yes, they are. In fact, this is phase one. Phase one means you've lost the normal position in motion. What are you looking at now? You've gained the normal position in motion. That's the body regenerating. That's the body regenerating. Let's look at another one. Again, before and after. Look at the force loading on that. Imagine that is turned, twisted, buckled. The discs are going to deteriorate because they can't get the same nutrients. Let's look at another one. Again, before and after. What are you seeing here? Buckling, turning, twisting, pain. We're not even talking symptoms. Let's just talk arthritis. I'm not going to bring up whether this patient had fibromyalgia or diabetes, which is what all these cases had, along with back pain, along with muscle pain, along with organ dysfunction. Let's just look at the degenerative joint disease and how they're going to treat it in the future and how some doctors are treating it today. This is called regenerating the spine, regenerating the body. Look at this, a before and after neck curve exercise. Degeneration of the spine, degeneration of that cervical spine. 97% of all headaches come from the neck. 93% of all migraines come from the neck. So should you fix the neck? By gosh, that's what we're doing. We're regenerating that spine. Look at this one. You're actually seeing destruction of that joint, where that joint is being destroyed and rotted. What are you seeing in the next patient, or in that same patient, just 90 days later? You're seeing that joint open up. That's reversal of degenerative disc disease. That's renewal. That's regeneration. That's human potential. Be aware of human potential. Look at this. 2 steel rods in this patient. 2 steel rods. This is after a scoliosis surgery. 21-degree bend. Post-care, what do they have? Is that different force loading? Did we change his degeneration? Absolutely. Last one, 7-year-old boy. Look at that. Absolutely no curve in the neck. 20 courses of antibiotics for recurrent ear infections. Post x-ray, beautiful arc of life. Beautiful arc of life. And absolutely no more ear infections. Now, this is the final case. Final low back case. You're seeing a beautiful disc here. You're seeing crushed discs. Then, a year later, oh my gosh, those crust discs are changing. Understand, if you change the force loading on a disc, you change the nutrition of the disc, you change the motion of the disc, you change the imbibition of that disc, the disc regrows. Disc is living material. Get this, discs are living material, so's bone. If it can change, it can change. Physicians today start paying attention to that. Look at this patient 2 years later. By gosh, those discs are restored and renewed. That degenerative disc disease, that degenerative joint disease, the osteoarthritis, however you want to name it. By gosh, don't just diagnose it, reverse it and have it renewed. This is Dr. John Bergman. God bless.